You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hello, Mihiraa. Please come in and have a seat. What brings you in today?
Thank you, doctor. Well, I've been having a terrible time with my legs lately. They're just awful.
I understand how frustrating that can be. Can you tell me a little more about what's wrong with your legs?
Well, they're red, swollen, and itchy all over. There are even some little bumps that are starting to ooze pus.
Okay. And have you had any recent injuries or accidents that could have caused this?
No accidents, but I did just try something new a few days ago. There's this spa treatment where these little things nibble at your dead skin. It sounded relaxing.
Interesting. Can you tell me more about it?
Well, yes, I got it. I did get a fish pedicure the day before to relax a bit before the performance. I do get a bit anxious sometimes, especially before big events.
Okay. And what is your occupation, Mihiraa?
I'm an acrobat, actually. I just recently had my first big stage show.
I see. Congratulations. Mihiraa, can you tell me more about the symptoms you're experiencing in your legs? Are there any specific areas that are more affected?
Yes, it mostly seems to be on the bottoms of my feet and around the toes. They're very red and itchy, and it hurts to walk.
I see. Is there the discharge is coming from?
Yes, it's coming from under the toenails.
Yes, I see some inflammation and a little bit of pus around there. This could be a sign of a bacterial infection.
How does that happen?
Based on what you've described, it sounds like you might have contracted it as a result of the pedicure, which usually can carry bacteria that can cause skin infections.
Oh no, that's awful. What can I do to treat it?
Don't worry. There are a few options. We can try a strong course of antibiotics, like ciprofloxacin, to fight the infection.
By then, will I be all right? Is this infection serious?
That's a good question, Mihiraa. While antibiotics are usually effective, to determine the best course of treatment and the severity of the infection, we'll need to run a few tests. These might include a blood test to check for signs of infection throughout your body and a wound culture to identify the specific bacteria causing the problem.
What does that involve?
It's a simple procedure where a small sample of pus is collected with a sterile swab. This sample is then sent to a lab where they can grow the bacteria and determine the best type of antibiotic to target it specifically.
Oh, that sounds okay. So, depending on the test results, we'll decide on further treatment.
Exactly. The test will help us see how deep the infection goes. In most cases, antibiotics are very effective. However, if the infection has gotten into the bone or spread significantly, a debridement procedure, the surgical removal of dead, damaged, or infected tissue might be necessary to remove any infected tissue and promote healing.
Surgery? That sounds serious. Can't we just try the antibiotics first?
The antibiotics are crucial, but if the infection is deep-seated, surgery might be necessary to ensure a complete recovery. We can discuss this further after I get the results of some tests and know more about the specific bacteria involved.
You hear a physiotherapist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi, Mihiraa. How can I help you today?
Hi, thanks for seeing me. And I've been having some pretty bad muscle aches lately. It's making it hard to train properly.
Training? What do you do?
I'm a baseball player, so related to that.
I understand. To get a better picture, could you tell me a little bit about yourself? How much do you weigh? And do you have any specific dietary habits?
Sure, I weigh around 150 pounds, and I try to eat healthy most of the time. Lots of vegetables, lean protein, and enough carbs to keep my energy up for practice.
What about exercise routines?
I train at least 2 hours a day, hitting the gym for weights and doing drills on the field.
Sounds like you take good care of yourself. Do you have any health conditions or injuries you'd like to mention?
No, nothing major. Just the usual bumps and bruises that come with playing baseball.
Okay. Now, about these muscle aches. When did they start?
Actually, it was right after I tried this Thai body treatment a few days ago. It was supposed to be relaxing, but ever since then, my muscles have felt tight and sore, especially in my legs and lower back.
Interesting. Can you describe the pain a bit more?
It's more of a dull ache, kind of deep in the muscles. It gets worse after I train, and sometimes it even wakes me up at night.
Have you tried anything to relieve the pain?
Yeah, I've been taking ibuprofen, but it only helps a little. I tried a hot bath too, but it didn't seem to make much difference.
Okay, Mihiraa. Based on what you've described, it sounds like the treatment might have caused some muscle strain. The good news is that with proper treatment, you should be feeling better and back on the field in no time.
That's a relief. What kind of treatment are we talking about?
I recommend a combination of manual therapy techniques like massage and stretching to improve flexibility and reduce muscle tension. We can also incorporate specific exercises to strengthen the affected areas and prevent future injuries. This would be called a therapeutic exercise program.
Perfect. I'm willing to do whatever it takes to get back to playing.
Great attitude. I'll set you up with a 1-month physiotherapy program that will include all these elements. We'll reevaluate your progress regularly and adjust the program as needed.
Sounds good. Is there anything else I can do at home to help with the healing?
Absolutely. I can recommend some self-care techniques like applying ice packs to reduce inflammation and using a foam roller to improve circulation. Additionally, I'll provide you with some stretches you can do daily to improve your flexibility.
Thank you so much. I feel much more optimistic now.